Hey guys, Julie here with Birmingham Mom Collective. And today we're talking with an expert at UAB Medicine all about the pelvic floor, something that all moms need to know about. And today we're here with Gena Dunivan. Hi, Gena. Thanks for joining us.
Hi, good morning.
Good morning. If you will, just go ahead and introduce yourself and tell us what you do at UAB.
Yes, so I am a urogynecologist and the division director for urogynecology and reconstructive pelvic surgery at the University of Alabama at Birmingham. And so I take care of women that have pelvic floor disorders, which I know is something we're going to talk about today.
Yes, I'm so thankful that we're talking about this. It's a great topic, and a lot of moms don't even know that there's therapy or help out there for this, and that UAB offers some of those great things. So we've heard a lot about the pelvic floor. Some people know, some people don't, but some people out there might not know. Can you explain to us what exactly the pelvic floor is?
Yes, so the pelvic floor is a group of muscles and ligaments that help support our pelvic organs, which include the bladder, the uterus or the womb, and the rectum and bowels.
Okay, great. A lot of muscles there, right there. Really important ones. Okay.
Yes.
Okay, what kind of issues can arise with the pelvic floor? Maybe about like when you're pregnant and then maybe after pregnancy.
Yes. So unfortunately, I do feel like the pelvic floor or pelvic floor disorders are a well-kept secret. And part of what I want to do is make sure that they're not a secret anymore. And so that women know what's going on with their bodies and what changes they might expect, what's normal, what's not normal, and that there's a lot of things to do to help. So obviously, when we're pregnant, our muscles and ligaments stretch more and relax to help us with childbirth, for example. But those same muscles and ligaments can be damaged both from just carrying the pregnancy or having either a vaginal delivery, but even sometimes a C-section. And so when our pelvic muscles and our ligaments are not working the way they're supposed to, it can cause problems such as urinary incontinence, which is leaking urine. And that could be with sneezing, coughing, jumping on the trampoline is something that happens with a lot of women, or like a strong urge to go and not being able to hold your urine, or even having accidents with your bowel movements. And also there can be relaxation of those pelvic floor muscles kind of into the vaginal area, which can cause feelings of pressure and heaviness. So all of those things can potentially happen. A lot of times they may not happen, or we may not notice them until when we're well past having our children, when they're quite a bit older, but sometimes it can happen pretty soon or soon after childbirth. And there's a lot of movement and interest in some of these preventative things. And so that's part of the idea of that you don't have to wait until you have these problems to seek help. And there's ways that we hope we can help women feel empowered to either seek care or do things to help themselves to prevent these problems.
That's great. I didn't even know that. So let's talk about some of those issues. We talked about jumping on the trampoline or sneezing. You said that you can have this during pregnancy, right after you deliver, but then beyond.
Exactly. So what can happen is a lot of women might notice that. And I use the trampoline because that's always like the great equalizer for when people be like, oh, I don't really leak necessarily when I sneeze, but then if I go to the trampoline park, definitely. So what I say about these things is that they are common, but that doesn't mean that it has to be normal. And so that means that there are a lot of things that we can do to prevent that. So yes, we may notice those issues when we're pregnant or soon after, and they may not be that bad or that bothersome. But then as we age, because of a variety of things, it can become more bothersome then, to where it's really something that you might want to do something about.
Yeah. Okay. So let's talk about what kind of care and treatment that UAB provides for people that want to do something about this
Yes,
problem.
exactly. So what I love about our team here is that we really provide the whole scope of care, which might be just that you want to come in and see somebody and be assessed to just find out what's going on. But then next steps might be learning more about how to do those pelvic floor exercises, which can do a lot of good preventative help if, like a lot of women, maybe that's a hard part of our body to access because it's not quite like, okay, I'm gonna work out my arms now. It's a little bit harder sometimes to make sure we're doing it right. And so we have physical therapists here that are pelvic floor physical therapists. So they specialize in this, and they are really wonderful and have so many unique skills to help women learn not just about the pelvic floor, but our cores, all the things that we can do to kind of help keep that area strong and healthy. There's also options that are not surgery, which might be, sometimes there's a little device that you can get fit for that goes into the vagina. It helps push against the bladder so that when you do cough or laugh or sneeze, it helps support that. And then there's even surgery. So it's nice to know, because sometimes women are worried. They think, oh, I don't want surgery, or maybe there's nothing I can do. And there's really a whole range from doing nothing all the way to surgery and anything anywhere in between. And we can really individualize the treatment for what each woman needs.
Yeah, that's amazing. So it's just like working out a specific group of muscles that you probably don't think about working out.
Exactly.
Okay. Okay, so who is a good candidate? We've talked about some of the treatments. So let's talk about who might be a good candidate for therapy or for surgery, that kind of thing.
Right. So basically, the thing that I say about pelvic floor disorders is that nobody gets to decide how bothered you are by them, but you. And so really, anyone that wants to learn more about their body, if they're bothered by any kind of symptoms they're experiencing, are great candidates for all of these options, especially if you want to, physical therapy is a great option for wanting to just maybe do some preventative work or just learn more about how to stay healthy and keep that part of your body strong. Basically, anyone that's motivated and interested is a good candidate. People that want to avoid surgery because sometimes, have young children at home or working, any of those things, those non-surgical options like the device or physical therapy are great options. And for women that are maybe experiencing a lot of bother, surgery is a great option too.
Okay, great. And I would say, yeah, if there's a mom out there that it's ruining your quality of life, you're thinking, I can't go work out, I can't do jumping jacks, I can't, there are some great things out there that can help you. And UAB Medicine is a great resource for moms out there for sure. Well, thank you so much, Gena. If you are out there today and would like some more information, uabmedicine.org/women, and you can find all the information about the things we've talked about today. All right. And thank you so much for joining us, and we'll see y'all next time. Bye.
Thank you.